My name is Susan Zachariah. I am one of the board members of OCAMPR. I'm the vice president, and I have the pleasure of introducing this workshop to you all today. I'm not going to speak for too long. I just have a little bit of information about our speakers, and then I'll pass it over to folks here. So first here I have Katherine McCray. She is a doctoral candidate in religious ethics at the University of Toronto, focusing on disability ethics and Eastern Orthodox theological anthropology. Her research investigates Christian representations of disability and reconstructs an Eastern moral philosophy around dependency, using the iconographic representation of the human being as an image of interdependency. In addition to her academic research, do you go by Kate?
Yes.
Kate is the facilitator for the mental health ministries of the Assembly of Canonical Orthodox Bishops. In this role, she and Bishop John Abdallah oversees the Assembly of Bishops' first workbook series written by clinicians and Orthodox faith leaders on topics of mental health and community support. That's Kate. And presenting with Kate is Sangeetha Thomas, who is the Director of Mental Health Ministries for the Assembly of Canonical Orthodox Bishops of the United States of America, and is also a licensed professional counselor with a private practice in Dallas, Texas. As a director, she collaborates with an interdisciplinary team of professionals in mental health, ministry, and theology to create resources that support the mental health needs of Orthodox Christians across the United States. In addition to managing a national needs assessment and directory of mental health professionals, she has coordinated the development and launch of a crisis response training program entitled Peace of Mind, which I heard a few people talk about here, which equips the clergy and lay member leaders in the mental health first aid and Orthodox bridging. As a psychotherapist, Sangeetha works with adults of diverse backgrounds who are healing from trauma, exploring multicultural identity and intergenerational trauma as children of immigrants, and or learning to integrate their faith identity with circumstances of life. Those are our two speakers. I'm going to go ahead and sit down and let you guys take over. Thank you for being here.
Thank you, everyone, for being here. So just to give you a kind of brief overview of what we're about to do, I'll be sort of presenting the guiding principles behind how we've shaped mental health ministries, the Assembly of Bishops Mental Health Ministries, what our kind of approach is to handling stigma in our communities, how we've grounded that in Orthodox theology and anthropology, understanding ourselves as both body and soul. And then Sangeetha will give you sort of the applied structures of where we are right now in mental health ministries, some of the goals and approaches we have toward resources that should be coming out. I'll mention very briefly the book series, and then she'll kind of give more structure and contour to the book series. But that's our main focus right now in mental health ministries is a 4-book series, which we're really excited about. So the goal of this presentation is to orient you on goals and ongoing work. So me goals, Sangeetha, ongoing work, of the Assembly of Bishops Mental Health Ministries. To begin, I'd like to give you an overview to our approach to mental health as ministry, how our core grounding as Orthodox Christians opens us up to innovative ways of conceptualizing the body, health, and the role of the supportive community. The approach of the Assembly of Bishops Mental Health Ministries is to integrate Orthodox spirituality and faith practice with a clinically informed understanding of medicine and psychological care. So Father George Morelli of blessed memory used to write primers in Orthodox theology for clinicians. Some of you in the Antiochian tradition may remember all of these sort of primers that he would do. And his goal was to orient all of us in who we are as human beings. So he did this because he believed that a primary reason that we Orthodox misunderstand mental health approaches in clinic or mental health approaches spiritually are because we have a theological error. So this is kind of an unconventional approach. If you have parishioners or the faithful who are reticent to access mental health care, you might assume that there's a misunderstanding about what clinical care is. But Father George's response was that there's a spiritual misunderstanding going on. So his contention was that we don't understand who we are as human beings. It's not that we primarily do not understand how clinicians work, but rather that we don't understand ourselves. More pointedly, we don't understand our own human nature. When the faithful are hesitant about mental health supports or resist discussing mental health, rather than simply stating that they have misunderstandings of clinical care, Father George observed a spiritual misunderstanding, that Orthodox often regard mental health needs as exclusively spiritual, that prayer and fasting or community togetherness should solve all our needs. Such a belief overlooks that we are embodied and that aspects of mental health relate to the body. We misunderstand our own human nature and the role of the community in our spiritual development, and we sometimes put the soul in competition with the body. So when we do this, the body is then denied. When we do this, we misrepresent the human being itself. We make it shameful to need one another and shameful to require medical or therapeutic support, especially on an extended basis. This means that when correcting negative opinions of mental health care amongst Orthodox Christians, we need to address both spiritual and medical accessibility, making sure that we clearly explain that the resources of the body and the resources of the soul are not in competition. We have a small range of clinical resources that make medicine more accessible to laity, but Father George's work represents an opposite move, making theological resources the framework for the clinical. This is a provocative approach, that Orthodox theology would have anything to say at all about clinical care, and one which needs to be handled responsibly. The core of Father George's mission, educating clinicians in our theologies of the body, emphasized two aspects: compassion towards self and others, and co-suffering as our primary understanding of support. So why do clinicians need Orthodox theology? Or what's more, what does anyone living with a mental illness or psychosocial disability, why would they need Orthodox theology? We don't have the greatest track record when it comes to healthcare at all in our communities. We are an immigrant church. Pew Research states that, or estimates that our parishes on average have about 40% first-generation immigrants. So we have a wide range of reactions to healthcare. And for many of our cultures, mental health is highly stigmatized. If it is discussed at all, mental health is the realm of spiritual health, and one only needs to buck up and pray more or fast more rigorously. Our reticence to address mental health conditions and the stigma that individuals face from a theological perspective has several threads. Some of that hesitancy comes into our cultures, or it comes from our cultures where healthcare itself is not integrated into life. We all know grandparents, tetas and yayas, who see a physician only when they are practically on death's door. So this is an example of not taking care of our bodies. So when we ask them to then fully integrate a mental health care into their daily life, they don't have the infrastructure to be able to do so because they don't take care of their bodies in a healthcare sense. So some of this is a cultural trait from the experiences of lack or poverty, a suspicion of medical care that develops from a lack of healthcare infrastructure. But when we develop opinions, sometimes they can motivate theologies, or vice versa. Sometimes negative theologies about our bodies are very sneaky. They slide under the radar. Theologies which communicate that our physical and mental well-being is not a part of God's organization for our lives. These negative theologies about being material bodies sneak their way into our faith practice. They suck the life out of our fasting. They turn Lent into deprivation instead of devotion. And they communicate that being embodied comes with shame. When it comes to approaching mental health conditions theologically, these sneaky theologies, or heresies really, present special challenges to establishing what God announces at creation, that the human body is good. The earliest anthropologies in the church describe the human being in two parts, mirroring Christ's two natures. This Christological approach means that we are a composite of two aspects, body and soul. St. Gregory the theologian calls them co-sufferers or co-laborers and describes the body and the soul as fully integrative and not competitive. Just as Christ did everything as fully God and fully man, we do everything as fully spiritual and fully bodily. So where then do the other aspects of the human being belong? Mind, heart, strength. For the earliest Christian texts, these are shared between both body and soul. So the mind is shared between body and soul. This means that mental health is established between the body and the soul as well, that the mind has parts that are physical and parts that are spiritual, that treating one without the other is not only ignoring how we were made as human beings, it may actually hamper our health. Treating the spiritual mind can accomplish great things, but it cannot make up for the physical mind's needs, because as St. Gregory tells us, they are not in competition for resources. The physical needs of the mind are no less important than the spiritual needs, and we require both for support. The role of the physician and the priest, then, if we follow St. Gregory, are cooperative because the whole human being requires collective care. A person can be thriving in their spiritual life, but require medical and social supports. And the Assembly's mental health ministries is a platform for a non-stigmatizing approach using this anthropology. The body and the soul are partners, and to treat them as partners means creating a supportive community in the parish that understands that a variety of medical, therapeutic, and spiritual supports are necessary to facilitate well-being. We as ourselves, how do we communicate to persons with persistent conditions in our communities that they are beloved? So persistent conditions themselves, we have these sort of curative models and curative approaches, but we know that in the rhythm of our daily lives as Orthodox faithful, that we may not experience full healing. And we need to think about how stigma feels for those who don't have full resolution of their symptoms, of their stressors. How do we integrate them into a community that communicates to them that they are beloved? We understand that sometimes curative action is off the table, that comorbidities and complex presentations are really, if we think about them collectively, quite average. Bodies are wild. They are not simple. And when a clinician imagines the church as a hospital, you imagine a quite different thing than a person without medical training, right? Without clinical training, the average parishioner imagines the church as a hospital functioning quite differently than OCAMPR members. So when you, OCAMPR, imagine the realities of a body, you imagine all the ways that we can change over time, all the supports that we need to extend health. You imagine that we can change, that the body is far from predictable, that well-being needs to be supported across the life cycle. So supporting well-being is not a one-size-fits-all approach. But when untrained people, untrained medically, when they imagine the church as a hospital, they do imagine cures, and they do imagine perfect bodies, and they do imagine fixed outcomes. So here, our theological approach also needs to be highly clinically informed. The church is a hospital. It is a place for rehabilitation and treatment and support, but it is not a place for a one-size-fits-all approach. Just like in best practices in medicine or psychology, the church as a hospital needs best practices too. Best practices to keep us responsive, responsible, and growing in body and soul. So this transitions us to talking about the projects of mental health ministries. We have asked, in our ministry work, we have asked several important questions that guide our approach. One primary question is how to tackle stigma and to tackle stigma as it exists in our communities. How do we establish that the body is good even while we experience variability, pain, change, and need for support? How do we communicate a positive theology about the body as God's good creation, while also teaching the faithful how to be responsive to their own variable bodies and the needs of those in their community? So like Father George Morelli, our starting place for mental health ministries is within the tradition. This year marks the launch of a 4-part book series with workbooks on topics of mental health written by Orthodox clinicians and faith leaders. We have tailored this book series to mimic Tom Hopko's Rainbow series. So if you're aware of this quite epic book series, the rationale behind those book series was not to be broadly accessible to all Orthodox Christians. It was for high schoolers and early seminarians to ground them in the principles of Orthodox faith. So since the 70s, the Rainbow series has taken off. Many of us experienced those when we were coming into the church, experienced premarital counseling, catechesis, a whole wide range of different applied locations for the Rainbow series. So what we wanted to create was a 4-part book series similar to Hopko's Rainbow series that had an accessible tone, that's overtly theological, and that can be used in multiple locations. So our workbook amplifies that. It won't need a facilitator to be a part of the parish community. With the workbook and the book together, you can have this in an adult Bible study or an OCF or a young adult gathering. So in our approach, we strongly agree with the different details that I've outlined about Father George Morelli, that to communicate mental health supports to Orthodox faithful, we need to address topics of well-being as theological and clinical, not ignoring either, instead emphasizing their compatibility. So the tagline in our work thus far has been clinically informed and theologically grounded. So for the new book series, we are beginning with a primer on who we are as human beings so that we can bridge clinical materials that are also included in the books and explain how the tradition tells us that we've been made by God to function holistically. So this includes what I've sort of given an outline of, that we are a composite of two things, body and soul, and emphasizing that the mind occupies both spaces, that a lot of our attributes occupy both spaces, so they need both in terms of well-being and healthcare. The impact of social environments is also a big factor for us in the first book. So to emphasize overall that we need to become a supportive community in the parish location. And what that involves in terms of being a supportive community rather than an inhospitable community, not offering just mere hospitality, but offering sacred hospitality, involves understanding the ways in which individuals with mental health disorders and extended disabilities experience stigma. So we can often, in our communities, obscure how suffering operates in the lives of people because we talk generally about suffering. Right? We talk about how suffering can bring us closer to God. We talk about how suffering can become an element of our lives that brings us closer to one another. But we don't often take time to understand that there's a difference between the type of suffering that is caused by sort of general conditions of being human and the type of suffering caused by injustice. So the type of suffering that's caused by injustice is where stigma lives. There are aspects of life generally that can bring suffering into what it means to be fragile. We understand that we are vulnerable as people. But there are also aspects of suffering that relate to injustice. So food, housing insecurity, impoverishment, lack of education, negative judgments from external forces. These are examples of socially housed locations for stigma, right? So this is the psychosocial model, right? That the social community creates kind of this environment where you can either experience hospitality and acceptance and warmth, or you can experience barriers. And people with extended disabilities often experience barriers that are put onto their own experiences of life, as if that comes packaged with being disabled, rather than being stigma. So these are social factors which sometimes are made to rest on the shoulders of people with disabilities, as if they come packaged with what it means to have a mental illness. And so for our first book, which is titled Understanding Mental Health, we really wanted to make sure that we emphasized the social component. This is one of the really beautiful aspects of Orthodox life, right? That we know we are not saved alone. We do not experience life in isolation. We experience it collectively. And that's how God intended human nature to operate. So within this sort of social model, we understand that our actions facilitate other people's well-being constantly, right? We facilitate one another's spiritual and physical growth. And in our stigmatization of certain members of our community, we are actually creating social environmental structures that create barriers. So one of the ways in which I like to describe this is to imagine how your church building very likely may have a ramp, God willing. We can talk about accessible structures fairly easily. We understand that in terms of mobility, someone needs to access the building to access liturgy. But we don't often think about the theological things that create barriers, the belief systems that functionally make stairs where a ramp could be. We have beliefs about what it's like to live with mental illness or live with extended states of dependency, extended states of disability that are negative, that create stigma. And by housing those beliefs, we don't actually think about how we're creating barriers. We're creating locations where people cannot experience the sacred hospitality that we're talking about today, or this weekend. So there's a model for disability called the social model. And the social model uses a term called disablement. And I love this term, so I wanted to introduce it to all of you today. So there's a medical model of disability, which is by and large kind of handled as a negative in disability communities because it establishes a sort of curative relationship with the body. So if you can't experience total amelioration of your symptoms, right, then what do? You're just sort of out there in space. There's no language for how to explain one's identity. And so that's where the social model comes in. The social model talks about social facilitation, but also identity and the variability in our identities that come with our changing bodies. So the social model talks about disablement as structure. Where we could put in a ramp, we put stairs in. That creates a barrier. The social model is aimed at eliminating barriers that exist in our social spaces, those sneaky theologies that sometimes we don't bring to the surface. We can build disablement, the process of creating barriers, or we can build hospitality. We can build environments that close doors or environments that open them. We can create barriers, or we can create banquet tables. But we cannot build hospitable parishes when we fail to recognize our own complicity in stigma. We have theologies that communicate the sanctity of life and the value of lived experiences. But if we choose those small, sneaky ways of undermining the goodness of the body, we instead communicate that people with disabilities and mental health conditions are exterior to the mission of the church. We ignore our own action in producing disablement in this way. But the church is a unique social environment. We know that we experience transformation and salvation together, not as isolated individuals. And we know that we're responsible for embodying community and hospitality, compassion. We even define theosis as how we come to reflect Christ's traits most fully. We do this together. And the Orthodox Church is in a unique position to have something very special to say about togetherness. In a world of judgment and stigma and individualism and isolation, we have a unique narrative of who the human being is and how we were made to be together. Our responsibility for the Assembly of Bishops Mental Health Ministries is to be involved in secure social and material environments. So this is what we aim to do and hope to do with God's grace and your prayers as we create materials.
Well done, by the way.
Thank you.
Really good.
Isn't she great?
Yeah. Totally.
We should keep her.
Yeah.
Give me 1 second to pin this. All right. Well, let me switch my slides. Okay. So as Kate mentioned a minute ago, she was addressing the content of what we do, and I'm going to be addressing more of the details of what it looks like when we try to take all of that epic content and put it into work and turn it into a ministry. So just before we do that, let me mention that the Assembly of Bishops Mental Health Ministries is structured with a team of consultants. They have a diverse background from theology to ministry to psychology, psychiatry, social work, public health, and psychotherapy. So just as much as Kate has acknowledged that the mind is complex and interconnected with body and soul, we also have to structure ministry to be interdisciplinary too. We have to be as multifaceted in order to try to account for all aspects of what makes a human person and their life on earth and their experience on earth and their experience of church and Christ through each other. So that's what we aim to do, not just in how we're structured, but also in all of the programs that we do. And so you'll hear a lot about different programs from me, but please know that they're all intentionally interconnected. So when we started the mental health ministries, when the Assembly initiated that, we took the approach that most clinicians and most hospitals take when there is a sudden realization that there are a lot of people in a lot of need. So we assessed what those needs were, and then we created a plan for attending to those needs based on urgency and priority, triaging, right? So for example, we knew as a team of experts in diverse backgrounds that for a lot of people, having a shared identity with their care provider, their mental health care provider, makes a significant difference. It can increase feelings of trust and safety, rapport, and resonance. And in effect, that can help support the client or the patient in achieving or reaching their therapeutic goals. So it's wise for us as a ministry then to look to the patterns that we can see in the social science world and then try to apply that to our church, to our community. And that's what we did. At the time, our first priority was to create a directory of mental health professionals. That directory has grown over 150 professionals now nationwide that are listed and available for Orthodox Christians. And we did that to support the accessibility of those people who are specifically looking for a clinician who shares their faith identity. Not because this is a requirement of Orthodox Christians. You don't have to have an Orthodox Christian therapist, but because, as Kate mentioned, breaking down a barrier for anybody who experiences it as a barrier was a priority for us. And that's what we did. And that was a priority for us to maintain a sense of a church as a community. Then in establishing this ministry, the Assembly was recognizing unanimously, by the way, that there was a reality of mental health needs. We just didn't have numbers to it at the time. When the bishop said, we need this, we kind of knew, we need this. That sounds like a good idea. But there was no numbers. So then we did a needs assessment to get the numbers to really see what are we looking at. That assessment was done in 2021, and we found that after surveying over 1,600 Orthodox Christians across the U.S., that 77% of those respondents said that they were struggling with mental health concerns. 87% said that they had a family member who was struggling with mental health concerns. And further into that study, which if you happen to swing by the Assembly of Bishops table, you'll see that little handout that has all the top 10 concerns that we have, and you'll get to see the full report of that study. But what we found was in our ministry, our plan needed to be to have widespread and intentional conversations among bishops, among clergy, among clinicians, and among lay people about what is mental well-being, what is mental health, and what is this issue that we're all reporting on a survey. Because if we are to effectively turn mental health into a ministry of the Orthodox Church and say that it attends to all the needs of all the people, then it's going to take every single one of us from multiple vocations, multiple disciplines, and we are essentially occupying multiple lanes on the same road. And that road is a road where we are trying to become a Christ-like community of wellness, of support that is free of stigma. Like our keynote discussion last night, we're on the way, right? And so we are all on that road. And last year, we did a presentation with Dr. Mamalakis and myself where we introduced the program Peace of Mind. We knew at the time when we created it, and I think a lot of you picked up on it as well, that's just one of the lanes on this multi-lane highway. training our clergy and our lay ministry leaders in basic level crisis response is great. And also, it's just one lane. We also have to look at things like what OCAMPR does, is a dialogue between clinicians and professionals of how they can improve their practice. We also have to look at the next lane over, which is what do we do about parishes where the relationship between different members of the congregation, average everyday people who are not trained in mental health, who maybe are struggling with it or have friends and family who are struggling with it, how are we creating a community that is mental health literate? So these are all the lanes we have to consider. And as Kate mentioned, just as we have to be clinically accurate and theologically grounded in order to challenge stigma, change stigma, remove stigma, and increase literacy, we also have to, as a ministry, look at the design and the implementation of our work. And we have to aim to make it complex, multi-layered, to where every project, every program that we develop aims to support the individual's relationship with God, their relationship and understanding with themselves, and also their relationships with each other. Taking this type of a long-term, wide-angle vision for ministry is the difference between just reactively creating trending projects because we see them happening in other places versus doing a ministry, hospitality of the church, and doing it with the spirit of compassion, like Dr. Clara had mentioned earlier this morning, the spirit of compassion and hospitality for the whole flock. So just how an individual can have a psychotherapist and a psychiatrist and a physician and a spiritual father, all part of one collaborative treatment team, our ministry can work with interdisciplinary consultants. We can also create programs that are all meant to intersect and overlap with each other, where one of the programs that we create supports another program that we develop, and then that connects to another program, and we create this ecosystem, this network of resources. So, for example, Peace of Mind, which is a training program for parish leadership, trains our clinicians and our parish leaders, lay ministry leaders, how to identify a mental health concern, how to engage with it, and then how to refer them to a mental health professional. Guess where the mental health professionals are? In the directory. That's also run by the Assembly of Bishops. So that's a great way where one program connects to another program. For our clinicians who are in the mental health directory, directory of mental health professionals, they can also look at our digital resource library, and they can use that to support their practice. And then for laypersons who are reading any of our work online, listening to our podcasts or watching our webinars to try to learn about the intersection of faith and mental health, they can now look forward to what we're developing next, which is The Living Well. That's the name of our book series. And this is a 4-part series of books and corresponding workbooks that explore that complex intersection, faith and mental health, and is intended to be used for group study. So each chapter is, Kate mentioned previously, very briefly, and I'm just going to go over it, that each of the book's chapters are going to be written with a pastoral tone and homiletic style in order to be accessible. In addition to that, every workbook chapter that corresponds with that is going to support individual reflection, like I said, their individual's relationship with God, their relationship with themselves, and then also group discussion. How are they relating to each other? Because we have to understand who I am and understand who the people are next to me. That's how we support change, right? We have to teach people how to think sometimes, and then how to apply that, and how to build a better community. This is a book series that, when Kate and I were talking about it, we often referred to it as, this is the book we wanted. When we were 20-something years old, going into college or coming out of college or confused, and we're trying to figure out how to navigate the world, and also that's the age of identity development. Any one of us who are clinicians know that. So how are you supposed to navigate the world, figure out your career and your identity, and get through college, and maybe find the person you're going to marry all at the same time while that's also the average age of onset for mental health concerns. So that's the target audience. Not the only audience, but that's who we're aiming for. This is the book we needed. This is a book that all of us needed in order to navigate that complex age range of 18 to 25. In addition to that, all of us here at OCAMPR, this is the book that we're looking for to refer our clients, our patients, our parishioners to. That's what we're aiming to create. So what we're aiming to explore in these books, especially this first one, are topics that are simple but profound. Things like understanding the mind, caring for the body and the soul, community factors for wellness, all in an accessible way, because we believe this is how we cultivate a co-suffering community while maintaining hope, joy, compassion, love. And what we're trying to teach people is how to be a steward of your own mind and your own body and soul, and also how to practice that hospitality and extend that hospitality to all the people that are around us. So from here, as we mentioned the workbook, what we want to transition us into is a group activity, a little bit of interaction, nothing too crazy, no jumping jacks involved, but it's called Think, Pair, Share. That's it's an educational model that I did when I worked at a social services agency, and it works pretty well. So we're going to use that as the model for our workbook. And so what you do is, first you take a few minutes to think about, individually, in silence, the questions that are going to be up on the screen in a minute. Second, we're going to ask you to take a few minutes to pair up with whoever's sitting next to you, ideally groups of 2, and you each take turns sharing, listening. Some of you are therapists, don't try and analyze anybody, but just sharing and listening, and just practice partnership. Just practice showing up, being there, listening, just being a presence. And then the third step will be sharing, where we come back as a group and we share what were the commonalities, what were the differences, what did you learn, and we just share as a group. So please do keep that in mind when you do the thinking, pairing, and sharing, that if you don't want something to be shared, that you make that clear either with your partner or you practice discretion within yourself. But let's look at our think, pair, share question, which I'm going to use the image that Kate had given earlier, which is, are we building barriers or are we building banquet tables? When she was speaking about stigma, I'm going to butcher it into a little nutshell of, are we being closed or are we being open when it comes to people who have mental health concerns or the idea of having a body and a soul or a disability, right? Are we being closed or are we being open? So I would like you all to take the next 2 minutes or so. You can jot down notes for yourself if you are that type of person. Just look at the questions, read through all of them, reflect on them individually. Okay, so if you could find a partner sitting next to you who you feel comfortable sharing with, and just take turns sharing and listening.
George, Papa George, San Francisco. Go. Director of family.
My family and I our first move after here. We had 2 young kids, and they weren't terrible, but they just weren't super helping us deal with when they're under 5 years old, so caring for 5 years old, I really felt that difference. Like, our hatchet 5 years old, I don't know, feel like emotion, but like, yeah, I felt very, I felt like, I felt like, okay, we were this, we were acting. I got a 1-year-old now, I got a 5-year-old, busy every day, relaxed. I just felt like I was seeing better and hearing malicious next matter. A higher personality.
Mine is kind of you're saying
It makes me very for me, it can be feel like it's not going at all. That really aspects of things we can't talk about all of the time. That some issues overshadow
And even like the social features. That's that. Like just the nuance. Like you just language barriers they can who would turn that down? Jesus is saying, I got a story for you. More people turn it down than you ever think, right? Luke 7:36, where the central woman of the town shows up to Simon's house, and Simon says, and Simon goes, "Oh, this must not be a problem." Dude, that is.
That's the same one where
I can't even see that.
No, the one where
Oh, are you thinking of the where it's the
federal physician? Yes, the federal physician one. And he asked, and instead of talking about like all fair, and Jesus asked, I think it's my do you see this one? And he just obviously does not see the school. Willing to accept whatever small.
You're now back 7. You crisscross this. Yeah, so when he asked that question, it's Simon, but the circulation woman is the one that will take whatever and have faith, accept whatever. But in this case of Jesus, though, which he's on the one, he gets mind blown on how people don't get hospitality. like a living experience. We'll even like sometimes talk on we're not talking about this thing we call faith ideology. Person, this person, the banquet table is like
Maybe if it's Chicago, we could drive to Chicago. Little part of
and then it's gradual getting them to the bigger time.
Alright, class. Can you hear my voice? Should we do 3 times?
Yeah.
No, it's okay. Alright, class. Let's do a share where just it seems like we have enough time and space for each table to maybe just share a couple of key points. You don't have to share everybody's life story. This is not group therapy. But I would love to hear, what have you experienced? How did that impact you? What did you learn about the people sitting at your table just by having the space? Just by us catering a space where you could have this type of a conversation. So anything at all that you processed, we'd love to hear from you. Yes?
I talked a little bit about inclusion and exclusion on a parish level, whether people come visiting, there's illness, friends or somebody visiting, somebody there a long time, and impacts relationships as far as barriers, sometimes unseen barriers, just because people want an establishment of people that come regularly for 5-10 years before you're inclusive kind of. And we're trying to break those barriers, and we're a growing parish. But I think sometimes understanding a little bit more on a parish level what mental illness is, so we can reach out to people that don't come on a regular basis or come at the end of the service for coffee hour looking for support. And sometimes we isolate ourselves because we're not really sure where that person's coming from, and I'm seeing them often. How do we invite them to come to that service? So there are barriers as to people are more comfortable with people they know and know for a long period of time. And to have, I guess it's too high of expectation to have all-inclusive, even though we're worshiping together, all-inclusive. And how to do that in a relationship level, understanding mental illness, understanding also seniors, citizens that are aging. Sometimes if you don't, I come from a background also home care, and so I kind of know how to reach out to those people. Just responsive, just as part of my background, but if people don't know how to know that, have some knowledge of it, they kind of are skittish and kind of back away a little bit. And just one real story, it was really cool. We were all waiting for our budget cards or whatever, and this line is growing and growing. And one guy had a walker, and somebody beat me to it. I'm like, he's in front of me, he has this walker until he's getting tired, and he's not going to be getting his car soon. But somebody, family, was so impressive behind me, two behind me. They approached him in such hospitality, sacred hospitality. I don't know, they're probably just regular Christian. I don't know, but it was like, sir, would you like to have my seat? Sit down. Why don't you? And so they're those bars to block the whole line, and invited him. Can you sit here in my seat while you wait in line? And just kind of really took that extra mile. They didn't have to do that. But seeing even sacred hospitality by what I'm learning from people around me, where just in public, it's just amazing.
That's beautiful. Well, and you bring up a really good point that we have to notice first, right? We have to even think about.
Yeah, radar.
Yeah, and you have to have a sense of social awareness, and that's something that I think in a Western culture especially, everybody is the center of their own universe. And sometimes that can feel very freeing, and other times it feels incredibly isolating, and it kind of leads it to like, you know, you're on your own, kid. Like you're in a walker, you better figure it out. And that's harsh. That's such a harsh way of living, and so I appreciate that story that you shared. So
It was a young girl that actually made the initiative and helped them over to the sea.
That's great.
I appreciate one of the elements in what you're saying is about exposure, right? For you, in your vocation, you have a lot of exposure to hospitality and bringing people close and how to speak to people gently in a way that's open, you know, and a lot of parishioners don't have that exposure, but they're only not going to have that exposure once, right? After they have exposure to it, it builds. And so I think a lot of what we're trying to create is a structure, because like what you're saying is we can teach parishioners how to be warm. We can teach them how to be hospitable. Once they see it in action, it's infectious. You know, you see people you don't know showing hospitality, and you have a transcendent moment where you're thinking about your own faith life, right? Those are those iconographic moments that just transport us, and they're infectious and exciting. And so that means that, you know, our parishioners who are, like you described, standoffish, we have to expose them to what it's like to be involved, you know, to be excited about people with mental illnesses or disabilities coming into our communities and contributing from the wealth of their own resources and feeling loved, right? Once we see that happen, it starts to take off. I love it. Thank you so much for sharing.
Good. Anyone else want to share their table's discussion? Sure.
We were talking about, well, part of what we were talking about was entering a new parish, and how that can be just really difficult. And like a couple of us were talking about how we entered new parishes during COVID with masks, and there isn't meal time, there isn't socializing, it was really hard. But even though still feeling the effects of that, and so even without disability, it can be really hard to have a sense of place, even though you've been there for a while. And so I think adding disability to that would exacerbate that potentially. Whereas I've had the experience where in my parish, where I also did start attending during COVID, I also had a COVID baby. And so people like babies, for the most part. And so I've actually feel like that has been really helpful to integrate, and now I have 2 babies, and there's been a few times recently where I've had to go to church, which is kind of far, by myself, and people will just scoop up my kids because they see I'm alone, and it's helpful, and I'm grateful because they're not strangers to me anymore. And so that has been very hospitable and encouraging, and knowing that there will be people potentially to help me is encouraging for me to take the kids by myself. Because I won't have to wrangle them alone. And so that has been really great, but taking that same excitement, people are familiar with kids, right? They're like, oh, I've had kids or grandkids or nephews or whatever. And translating that to other conditions, I think, is an obstacle because it's not familiar. People don't know what to do with it, and they're afraid maybe of messing up, making a mistake, or the unknown, or offending, especially in our culture, right? Being politically correct and all of that. So I think breaking down that internal barrier is maybe what we're working on. Because it's there, and I've seen it with my kids, and it's been just so endearing.
And I think other moms know, right? I know that if I come and offer my help, even if you say no, that will be a positive experience, right? It'll be a positive experience to tell a mom, no, I don't need your help, but thank you for offering.
Yes.
Right, and that's a bond that we share. I think Mediterranean hospitality is also one of the the greats, right? We're like famous for a reason. We can do food.
Yes.
But if we think about hospitality situations like that, we can also think about people who are, for whatever reason, living in their houses because of a physical condition and can't get to liturgy. We know what it's like to bring food. When people are bereaved, we know what it's like to care for them, right? It's exposure, it's familiarity, but it's also a sense of confidence, I think. I love that what you're describing is this sense of your own growing confidence because your parish has been warm to you and your children.
Right. Yeah,
that's incredible.
Because normally my default response is, no, I'm good. And I was like, no, I'm not good. Why did I say that? But that's just my default, knee-jerk reaction.
Take these children off my body.
Yeah, and so it's just, but the fact that, my kids are also okay with it, because they can get really clingy sometimes. And so there is this level of, no, cool, if this person picks me up, I know I'm in a safe place.
Trust.
And I see you. Yeah.
Yep.
And so, but that has built over, the last 2 years. It doesn't happen quickly, and I think that's another thing that people underestimate, is that these relationships take time. And so, it's an investment in relationship in your parish. And so, but also, that awareness, you have to get to know people to know what their needs are.
Yes.
Absolutely.
Well,
Right.
one thing I loved about what you said is you feel comfortable people scooping up your kids, which out of context sounds weird, but
Yes.
you feel comfortable with that because they're not strangers anymore to you. I think that's exactly what you said. And that's what we want to happen in our parishes through books and programs like this, that you move from being a parish, a person who visits a parish, to it becomes a community, to it becomes a family.
Right.
Right? When you don't, the only other place where you probably don't have to worry about where your kids are is when you're visiting family's house.
Yeah.
And that's what church should feel like. And it should feel like that for people with mental health concerns and disabilities too, where I don't have to have a mask, I don't have to be guarded, I don't have to be protective, I don't need to be looking out to see who might be offended or who might offend me. Thank you. Time's up.
Gotta go.
12:15.
Cut it out. All right. Okay, so I would love to hear more and more. Two things I will end on is, first of all, we do have an Assembly of Bishops table at the exhibit rooms. I know with the exhibit room being separate from the dining hall, sometimes the chatting and networking happens in one place and then the exhibit table's in another place. So please walk all the way down the hallway, turn right into that room, visit all the tables, come get all of our pamphlets and stuff so you can go back to your parishes and really promote the work that we do. Monica, who just spoke, is one of our Peace of Mind facilitators out on the West Coast. So you can ask her about it. We do have Matrushka Michelle Janakos, who is the Peace of Mind project manager. She's been running the table while I've been here. She's also going to be here today and tomorrow, so please do talk to her. And if you have questions about the book, you can come ask Kate or myself. Father, you had asked about the follow-up training to Peace of Mind. First of all, I'm so glad that you went to Peace of Mind down in Houston, and I would love to hear about your experience. We are working on the curriculum for a follow-up program that is specific to clergy. That program is not ready to be launched just yet, so we haven't done too much to advertise it, because we don't want to put the cart before the horse, but that is in development, and what it's intended to be is Orthodox bridging, which you got to participate in, is the theological bridge between mental health and faith. That is going to be expanded. And we're going to focus on pastoral care. We're going to focus on things like ethical dilemmas, like what does a priest do when there is a disclosure in the context of confession? Or what does a priest do when there's a disclosure of family violence and the rest of the family is members of the parish? And so those types of things, as well as the deeper theology and praxis of understanding the mind from a priest's lens, will be addressed in that curriculum. So we are getting our experts together, we're drafting that all up, but that will be available as online modules so that you went in person for Peace of Mind, you got the basic level training face-to-face and got that interaction. Now as a priest, you have your parish responsibilities that may not enable you to travel as frequently, so we're making that follow-up program as online modules. So that is something that we are working on. We just, like I said, have not done a lot of marketing around it because it's not ready to be launched yet. The book is in its drafting phase and slowly progressing into a revising and workbooking phase. So we're kind of in the thick of it. But our hope is that one book will be released every year in succession. So in a couple of years, we'll have a full set to give you. But we'd love to talk with you more about our work. Please do feel free to reach out to us. Visit our website. If you're a provider and you're not, or a mental health professional and not yet listed in our directory, please do apply. You can access that if you go to the main directory page and hit the button at the top right that says for providers. That's where the application is. But if you have questions, come and ask me. Make sure you steal some flyers because that's where all the QR codes are, where you can just like snap pictures and get to places. So that's all we have. We really appreciate your time, your interaction. I'd love to hear more about the discussion. Unfortunately, we ran out of time there, but really, really great commentary, so we appreciate it.
Great session. Thank you.
Thank you.